Hi, this is Dr. Sanchez from Miami Dental Sedation Spa. I want to talk to you just like I speak to my new patients that come in. They're questioning to see if they're interested in doing sedation dentistry. First of all, let me tell you about a little bit about the office. Dr. Vidal, myself, we have 13 years of experience with sedation, dental sedation. We were trained with faculty over at UCLA. And over the years, you can imagine we've seen hundreds of patients. The typical patient that we see for sedation tends to have fear, mostly because something happened during their childhood. Their experiences with a dentist when they were children was not so pleasant, and they've kept that in their minds, and it's very hard for them to come to the dentist. There's different fears, fears from pain, fears from the sounds of the drills, and this type of patient tends to be ashamed of coming to a dentist. It takes a long time to actually call an office. Then this type of patient makes an appointment and they come up with any reasons not to come in. So that's the type of patient that we see them on the schedule and they reschedule and cancel and they don't show up. It takes a lot to actually make it into the office. The typical patient is also male. We've had patients are federal officers, they're marshals, they're cops, policemen, and that is actually the male population is the more typical for sedation. The record of years of the patient not seeing a dentist is actually by a female. It was 20. She told me I'm very ashamed. I haven't been to a dentist in 25 years, and she remembered because that's how old one of her kids was, and so she could tell me right away that it was 25 years. What type of sedations do we offer? We offer conscious sedation. Conscious sedation, it could be oral or IV. Oral means we could give you pills before and during the procedures, and we could also do IV, where we introduce the medications via an IV. Take a look at the website. We have over 600 reviews of our patients. That way you could read about what they talk about us, what they say about us. We're not going to give you a lecture because of the amount of years you haven't been to a dentist, because of the condition of your teeth. And I know that's something that a lot of patients have in the back of their minds, and that is also another big factor that they don't want to come in because they don't want to get a lecture. At times, they've actually gone to doctors, and that's what has happened, and it has turned them off. Over the years, I've seen it. I'm not going to say I've seen it all, but I've seen a lot. So I have the experience, and I'm here to help. That's the reason why I have that special training. That's the reason why the whole staff is trained to treat and to help patients to get the dentistry that they need. So if you want, call us, email us. We can make an appointment just to talk. We could just be sitting in this room and just talk. Talking about another highlight of patients. I have a sedation patient that she did not allow me to put any instruments in her mouth, and that was fine. We were able to sedate her, and then we were able to decide on what needed to be done. So you're not the only one. We've been treating patients like you. Call us, email us, and we're here to help. Thank you.